have back pain at the same time you feel numbness in your lower leg and in your foot, well, in this video, I will share with you 5 common mistakes that patient doesn't know are actually triggering symptoms of sciatica. Hi, this is Doc Sherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that you would surely benefit from. Stay with me until the end of this video because you don't know the last symptom may be the reason why you're not experiencing relief of your symptoms. These are the 5 common mistakes that patient diagnosed with sciatica does, which they don't know are actually triggering or worsening their symptoms. Use of tight jeans and fat wallets in their back. Do you know that every time you use tight jeans and tight shorts and every time you have a fat wallet in your back when you are seated, these can actually increase the pressure in your sciatic nerve and can actually worsen your condition. In fact, this is an oftentimes overlooked cause which will trigger sciatica-like symptoms known as piriformis syndrome. That's why we need to do something about this if you want to prevent surgery altogether. For men, do prevent using thick wallets in your back pockets. Transfer it in front or even in your backs. And for women diagnosed with sciatica, it is more advisable for you to wear something looser, especially in the buttocks and in the hip area. This way, we will not worsen sciatica symptoms. Taking for granted the symptoms that you feel. Do you know why? Because there are certain instances wherein sciatica symptoms are considered a medical emergency, especially if you experience inability to feel and control urination and defecation. This is a medical emergency that needs prompt medical treatment, or else paralysis may happen from the hip down to the feet. And this shouldn't be taken lightly, both for patients and the family alike. That's why if you feel symptoms of lower back pain, numbness, and pins and needle sensation, those are not ordinary symptoms. That means that there is nerve involvement. Your nerves, these are like long cable wires. And sometimes, if the damage is so severe, it may take time for it to heal, and prompt medical treatment is really advised. Sitting for too long. Do you know that every time you sit for too long, if you are an adult who have been diagnosed with sciatica, and if your work entails sitting in front of the computer for extended hours in a day, or if you are used to long driving, these can actually worsen sciatica symptoms. That's why if you have been diagnosed with sciatica, either it may be caused by osteoarthritis in the spine or disc herniation. Always remember our 30-30 rule. Every time you sit for 30 minutes, be sure to stand and stretch even for 30 seconds. This will lessen the compression of your sciatic nerve and will not trigger sciatica symptoms. If your work entails sitting in front of the computer, it is very important for you to have the right posture. Your back should be straight with your knees bent 90 degrees. It would also be very helpful if you can find a chair with a proper lumbar support to support your lower back, or if you don't have one, you can simply insert a rolled towel here in the arch of your lower back. This way, these can help relieve symptoms of sciatica and would help remind you of proper posture. Wrong sleeping position and wrong lifting techniques. Do you know that most often than not, there are really instances where patients diagnosed with sciatica would often complain that they are unable to sleep well at night. Do you know why? That is because neuropathy symptoms tend to worsen at night or early in the morning, and some of them are not aware that their sleeping position is actually aggravating the condition. If you sleep on your stomach, this is really not good for you. It will give you different conditions of the spine. For one, it can trigger sciatica symptoms, and it can even cause disc herniation. So to help you, the best recommended sleeping position if you have been diagnosed with sciatica is for you to sleep on your side. You can place a small pillow between your knees, or if you want to sleep in the supine position, your best option is also to place a small pillow under your knees. Also, oftentimes overlooked, but do you know that the most common cause of sciatica and back injury that I see in the clinic, especially for seaman patients, is actually due to poor or wrong lifting techniques. This is actually not good for the spine, and it can cause disc herniation and sciatica. So always keep it in mind. Even if you had already been diagnosed with disc herniation, the proper lifting technique is for you to bend your knee with your back straight. Also, if you need to carry something, put it near your chest. This way, the weight is evenly distributed in the spine. The things that you have learned from this video so far are very practical and very useful if you want to prevent spine surgery altogether, which can get very expensive and which can be a big hassle for you. If you find this video helpful, please don't forget to click the like button below as your way of supporting me and this channel. Also, please comment your age in the comment section below. That way, I can help further make videos that can help you with your sciatica symptoms based on your demographics and your age. The wrong back exercises. Do you think that all back exercises are for you? No, you're wrong. But you need to determine the correct exercise for you, because this can be one of the biggest key factor that will help you manage sciatica conservatively without any spinal surgery. Why? Because the right exercise can actually widen the space within your vertebral canal. The right exercise for you is based on your X-ray or MRI result. Or if you haven't done one yet, this is based on the position of the spine, which will decrease your symptoms. If you're not quite sure of the proper exercise for you, we have a video here, check on it. This will really simplify your life for as much as sciatica treatment is concerned. These are the 5 common mistakes that patients take for granted but are actually worsening sciatica symptoms. Use of tight jeans and use of fat wallets in the back. Brushing off symptoms slightly, because these can delay diagnosis and can delay treatment plan. And in some cases, these can lead to paralysis if sciatica symptoms are already a form of medical emergency. Wrong sleeping position and wrong lifting techniques can actually aggravate and can be the cause of sciatica itself, which can also be the reason of spinal surgery. Sitting for too long. This can actually increase the pressure in your spine and can trigger sciatica symptoms. And the wrong back exercises. Also, if you want to know about the red flags of sciatica, which shouldn't be taken lightly, we have a video here. Check on it. It will greatly help you. If you have reached the end of this video, please comment back in the comment section below. Thank you very much for watching. I will see you on our next video.